and thank you all for joining us today. I'm Ann Casti. I'm an outreach and instruction librarian at Minitex, and we have the honor of hosting this fall's series on consumer health librarianship. Minitex is a Minnesota library organization that provides a wide array of supports to libraries and schools across Minnesota, North Dakota, and South Dakota. We provide resources, professional development, services, and expertise to help libraries better serve their communities. And we're proud to sponsor today's session, and we will be hosting the event page for this series where all the recordings and handouts will be hosted. So you might see more emails coming from me about that. I'm also admitting people from the waiting room here. So without further ado, I will now hand it over to today's featured speaker, Stacy Hendren.
Thank you, Anne, and hello, everyone. Welcome to Providing Mental Health Information at Your Library, the first class in a series of consumer health information courses for library staff, sponsored by Minitex and the Network of the National Libraries of Medicine. With me, I have Catherine Chu from the University of Minnesota Health Science Library. This week, she'll be providing technical support for attendees. And if you haven't already, please register for effective health communication and health literacy, which Catherine will be leading on October 3rd. Also with us is Ann Casti, who will be helping make sure everything runs smoothly. And just a huge thanks to Anne, Minitex, Catherine, and the Network of the National Libraries of Medicine for making this series possible. So my name is Stacy Hendren, and I use she, her pronouns. Since 2018, I've taken over 30 hours of consumer health reference training. I have level 2 specialization from the Medical Library Association, and I've completed the Train the Trainer training from NNLM. Anoka County Libraries also became a partner outreach program partner for NNLM with me as an ambassador. I'm so excited about this topic and the consumer health specialization, as I have been able to implement consumer health reference concepts into community partnerships, programming, and my reference work. Mental health is especially important to me as I thrive with anxiety and depression, and see how information and communication can reduce stigma. I'm also really excited to have you all join me in gaining this expertise and supporting our communities throughout Minnesota and beyond. Please reach out if you have further questions after today's training. So just a few housekeeping items. Please locate the chat box. We'll be using this location for questions and have specific times set aside. We'll also be providing a link to the evaluation and directions at the end of the session, which is the first step to claiming credit towards your consumer health information specialization. And I'll be sharing more at the end. You can turn on the captions. I think I'm actually presenting captions, so I don't know if you can turn them off, but you can turn on again. And finally, we just want to make you aware that all sessions will be recorded and may be found on the Minitex series page, as Anne said. Finally, I want to mention that there will be a lot of links in today's presentation. We'll do our best to put them in the chat, but all the links will be available in a handout, which has even more links. So you can focus on the content, not remembering the web addresses. So let's get started. Since some of you may be first-time attendees at an NNLM class, I want to briefly introduce the organization. The Network of the National Library of Medicine, NNLM, is part of the National Library of Medicine, which is within the National Institutes of Health. They are the education and outreach arm of the National Library of Medicine. They work regionally, getting to know communities on the ground and helping those communities best serve the people they know best. As an employee of a member institution, you qualify for free classes through NNLM, both on demand and virtually. NNLM is present across the entire country and works to advance the health and well-being of everyone through access and understanding of how to use health information by providing funding, training, and other forms of outreach and engagement. So I encourage you all to visit nnlm.gov to learn more. In today's session, we're going to cover some mental health definitions and statistics, tips for reference interactions. We'll highlight some information resources, and we'll look at some ideas for programs and services around mental health. So please take a moment to write in the chat which section you are most interested in learning about today. One thing we'll not be talking about today is how to deal with someone in your library who is experiencing a mental health or mental illness crisis. At NNLM, we recognize that this is an important skill for people, but feel we're not the people to be handing out advice on that issue. We're generally not mental health experts. However, I can share with you a couple of resources for finding professional development opportunities on the topic, such as Mental Health First Aid, operated by the National Council for Mental Wellbeing. That's at mentalhealthfirstaid.org. There are also a number of commercial sites that offer training. Catherine, what are we seeing for the main interest today?
I am seeing programs and services, best practices for reference interviews.
Yeah,
That seems to be program and services and best practices for reference interviews seems to be the top ones.
excellent, excellent, great. Well, I'm going to start. The mental health facts is super quick. So as an organization and as library staff, you can provide quality health information for your patrons to learn about mental health topics. This can be regarding a particular mental illness, maybe during a stressful event such as a disease outbreak, natural disaster, or even having a child. It can also be regarding resources for practicing self-care, for personal use, or educational use. So let's start by looking at some basic mental health definitions and facts. So mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act as we go through life. It also helps determine how we handle stress, relate to others, and make choices. Mental illness refers to a wide range of diagnosable conditions and disorders that affect our mood, thinking, and behavior. Examples of mental illness include depression and anxiety, schizophrenia, eating disorders, and substance use disorders, to name just a few. A mental illness can make life more challenging, but it is not uncommon. Many people have mental health disorders or concerns from time to time. It becomes problematic if left unmanaged or untreated and may become a serious mental illness affecting one's activities and daily living. So mental illnesses are prevalent across the United States. It can affect people of all ages, including children and older adults. In the chat, can anyone guess the missing number? So 46% of Americans will meet the criteria for a diagnosable mental health condition sometime in their life. Half of those people will develop conditions by the age of 14. And 50 million US adults currently live with a mental illness, which is 1 in 5, or about 20% of the population. So nearly 1 in 5 American adults will have a diagnosable mental health condition in any given year. Mental Health America ranks, so that is from Mental Health America, and Mental Health America ranks states by prevalence of mental illness and access to care. They also have a mapping section with state and county data. Another way to find information more specific to your area is to explore your county community health assessments. In the county where I work and live, 20% of respondents to the survey said the top reason for delaying or not getting care was they didn't know where to go or they were too nervous or afraid. Mental health conditions are common, and there is a place at the library to make an impact by helping people know where to go and helping them find that reliable information. Does anyone have any questions at this time about mental health facts? Catherine, have you seen any questions?
Not yet.
Great. Again, put those in the chat. So that was a really quick overview. And so now we'll switch gears and look at how best to address mental health information requests. So I'll be using the term mental health more broadly throughout the rest of the presentation. So it might encompass disorders or illnesses, but I'll clarify when necessary. So mental health questions can come to you in many ways. So I want to emphasize, use the same approach as with any other reference interview. The reference interview might present itself anonymously over chat or email, on the phone, in person, at a reference desk, or through a research consultation with a student. What starts as a research question can easily turn into a question for mental health information or a service referral. So let's say you get a question from a patron who has a child with an eating disorder and is struggling to make sense of their child's experience. They want information, so what do? You use the same approach that you would with any other reference interview. Respect confidentiality by lowering your voice, or maybe bring the patron to a quiet area, but where you can still be seen by others. Active listening shows that you're paying attention by maintaining an open body position. For example, not crossing your arms and maintaining comfortable eye contact. Keep it in mind that there are various cultural views on eye contact. Ask open-ended and neutral questions, which result in getting more information beyond a yes or no. And be sure to let the patron finish their questions before responding. Be empathetic and patient. Know that the patron may not be aware of the potential impact or seriousness of a disorder, so be prepared for emotional reactions. If the patron is having a hard time asking a question, be patient. Once they have asked the question, maybe say something encouraging and supportive. So my favorite thing to say is, "Thank you for trusting me with that information," or "Thank you for trusting me with your story." Do not share your personal stories to demonstrate that you understand. So this may convey the wrong message because each situation is different. They're there to have their needs met, not the other way around. And this may be difficult for some of you, but allow time for silence. It may be the moment someone is taking to gather themselves, to process the information that you've just provided, or determine if they want or need to ask further questions. You too may need a moment to think through where to look for resources and gather your own thoughts. It's also very important to know the difference between providing health information and giving health advice. As you know, we as library staff don't give medical advice, and we never diagnose. It's best to refer individuals to their healthcare providers if they have questions that are beyond the scope of providing information. Also, whether a patron has a mental illness or not, if they're asking questions that we feel are outside of reality, it is okay to answer matter-of-factly. Take the person seriously as you would any other person, any other patron. And I personally want to add, be okay removing yourself from the conversation. One of my favorite phrases is, "Do you have a library question today?" And if not, you can respectfully disengage yourself. Or if the question challenges your mental health, refer the question if possible, or find a way to practice self-care afterwards. If you have any go-to phrases, please put them in the chat. Or if you're a solo librarian, please share any strategies you might use. So I briefly mentioned open-ended questions in the previous slide. Listed here are some examples of open-ended questions you can use to learn more about what the patron's looking for. So ask open-ended questions to clarify the patron's needs. Are they looking for health information? Are they looking for local services or a support group? Is this for a class assignment? If clarification is needed, just ask. You can say, I'm not certain I understand. Can you give me an example or tell me more? Tell me more is one of my favorite questions to ask to help me both get more information and help give me a little bit more time to figure out my next steps. And if you have a go-to open-ended question, please add it to the chat. Just as it is important to ask open-ended questions, it is important to listen without judgment. This slide is from the Mental Health First Aid website describing 5 tips for non-judgmental listening. Non-judgmental listening. Reflect on your own state of mind. Adopt an attitude of acceptance. Develop verbal skills to show you are listening. Maintain positive body language and recognize the cultural differences around mental health. And NLM does provide multilingual, multicultural resources as well. Mental Health First Aid is an organization that provides training with a fee, but they also have excellent collection of mental health resources on their website. You can consider subscribing to their newsletter for tips and information. And keep in mind that you may also be able to find a training through a local mental health organization or through your local health department. NAMIMN.org, Minnesota, provides a variety of classes online and has presenters that might be available to visit your location. And lastly, NNLM offers an on-demand class called Introduction to Health Reference that goes into more details about library policies. And so we'll have a link to that on the registration page on the handout. Any questions in the chat or open-ended questions that people shared, Catherine?
No, they've been pretty quiet. So everybody, if you've got questions or want to share, please do put something in the chat.
And that's just fine. Quiet and taking it all in is great, but we are available if needed. Okay, let's take a look at some health information resources and then review a few ideas and examples of programs and services you could do in your library. Some of the mental health resources I'll be going over may look familiar, but you also might find some new resources to consider as well. We won't be going live to any of the sites, but the handout for the session will have links so you can explore the resources. And then Minitex will be sharing the handout via the program to program participants and on the series page. If you have additional resources you use regularly, please add to the chat. Okay. The Network of the National Libraries of Medicine has a resource guide for public libraries, though any library may find it handy. Many of the resources I'll be mentioning today are also located in this guide, which is reviewed regularly. And then the first resource is MedlinePlus. If you forget all the resources but one today, remember MedlinePlus. MedlinePlus is an online health information resource from the National Library of Medicine for patients and their families and friends. Clicking on the Health Topics page will display a variety of categories. Mental health and behavior is located under disorders and conditions, which is a good place to start. You can also use the You can also use the search box at the top to find other results within MedlinePlus. MedlinePlus brings authoritative resources to you, and it's my favorite non-database to refer patrons to. You don't have to do a Google search and wonder if the search results are quality online resources. The resources contained in MedlinePlus must meet the site's strict criteria for inclusion. The health topic pages are organized alphabetically. So here's a screen capture of the health topic page on child mental health. Notice there's a table of contents near the top, and you can click directly on any of these links to jump to that section. Or you can simply scroll down to view the page, scroll down the page to view other content. For a user who's not sure what they're looking for, they might find the Start Here content really helpful. There's information and links for diagnosis and tests, and on treatment and therapies, and sources for the information are noted on the page. Over on the right, you'll see a section titled Related Health Topics. So for example, bullying and cyberbullying and child behavior disorders are related topics to child mental health. And those might provide additional information for the user or yourself. If you continue to scroll down, you'll see that there are links to journals, to journal article citations in PubMed, where medical literature can be found. Additionally, you can find an expert, age-appropriate information for your children and patient handouts. Some of the handouts are also in languages other than English. Returning to the MedlinePlus homepage, on this screen capture, you'll see a link for health information in multiple languages. So you can browse health information in various languages or by health topic. On the second screen capture, you'll see that there's a list of multiple languages for handouts related to depression. And here's an example of a handout on feeling sad in Arabic. Notice that this handout also has information in English, which is really helpful if a patron takes it to their doctor, so the doctor can know what is being included in that information as well. And all topics in a language other than English will have a version in English. Then I'm going to make a plug for the NNLM class titled Providing Multilingual and Multicultural Health. It's available regularly through NNLM. Catherine and I will also be presenting the class at the upcoming Minnesota Library Association conference. From the sitemap, MedlinePlus provides links to directories to help you find libraries, health professionals, services, and facilities. NLM does not necessarily endorse or recommend the organizations that produce these directories, nor the individuals or organizations that are included. Also from the sitemap, you can view a list of organizations and agencies whose materials appear on MedlinePlus health topic pages. These organizations include the National Institutes of Health Institutes, National Institutes of Health, centers and offices, and other U.S. federal government agencies, and selected non-government organizations. And please don't limit yourself to what is listed here. State health departments may also have information on local services that might not be included in these lists. This is just a good place to start. Medication may also be prescribed as part of treatment for someone who has a mental illness or disorder. If that is the case, MedlinePlus also has information on drugs. MedlinePlus uses information provided by the American Society of Health System Pharmacists. The screen capture on the right is an example of an information page on the antidepressant escitalopram. It has a similar table of contents that we saw earlier with the health topics. Take note of the red highlighting on the page. It provides important warning information. So when the FDA issues a warning, it is then highlighted on the resource. Information about herbs and supplements is also available from MedlinePlus, as you might receive questions about complementary or non-prescription drugs. This is a reliable resource to use for that information as well. MedlinePlus pulls from a variety of authoritative resources, like the Natural Medicines Comprehensive Database, the NIH Office of Dietary Supplements, and the National Center for Complementary and Integrated Health. For information about medications, I suggest starting with MedlinePlus. But if MedlinePlus doesn't provide what you're looking for, there are several sources you can use. One is DailyMed. Daily Med is a joint effort between the National Library of Medicine and the Food and Drug Administration, and currently it contains over 147,000 labels submitted to the Food and Drug Administration by drug manufacturing companies. So you can find the packaging and package inserts that are included with prescriptions. This screen capture is for the medication we just looked at in MedlinePlus, escitalopram. And of course, you may have other drug resources available in your library collections. Just be sure that they are as current as possible because medication information can change. For those looking for alternative or complementary treatments, you can also visit the National Center for Complementary and Integrated Health for authoritative information. So I just mentioned that this resource is cited in MedlinePlus. The NCCIH is one of the 27 institutes of the National Institutes of Health. So they conduct and support research and provide information about complementary health products and practices. So here's an entry on depression, and on the right-hand side, there are links to research on the efficacy of other modals of treatment. The National Institute of Mental Health provides information on specific conditions and treatments, along with free materials that you can download or order for your library for your personal use. Keep in mind that other institutes and centers may also have information, such as the National Institute on Aging or the National Institute on Minority Health, which may have mental health information that's more specific to these populations. SAMHSA is the Substance Abuse and Mental Health Services Administration, part of the U.S. Department of Health and Human Services. Its website includes information for the public and for professionals. Topics include school and campus health, seeking help after traumatic events such as natural disasters or shootings, and of course, coping with COVID-19. SAMHSA is also a good resource if you're planning a program or service, but for some, this resource may seem very overwhelming. You might want to take some time to explore the website and select specific links that you think your patrons would find most useful. They also have publications that are free to download or order. You might consider having some copies available at your circulation desk, creating a LibGuide, or distributing these resources at a library program or in your brochure area. And some of these brochures are also available in Spanish. I'm sure many of us are more aware now of what the Center for Disease Control does since the start of the pandemic. But what you may not know is that the CDC also provides information on mental health, both for professionals and the public. Their website has information on mental health, including tools, resources, quizzes, and data. And the CDC mental health resources can be good to educate yourself or to gather information for a program or service. But members of your community may also find it helpful. Another organization that provides mental health resources is the National Alliance on Mental Illness, or NAMI. NAMI has resources for people with mental health conditions, including peer-to-peer support groups throughout the United States, as well as mental health education resources and classes. Many states have local chapters of NAMI. NAMIMN.org is the Minnesota chapter with additional resources and trainings, including several free online trainings or speakers that may be available for event. I encourage you to check out your local as well as the national resources. Here in Minnesota and the Minnetex area, we're lucky to have these databases which extend the reliable resources that we can provide. All of these are available through eLibrary MN on the Health, Medicine, and Nursing section. I want to highlight just a few. Alt Health Watch covers complementary, holistic, and integrative approaches to healthcare and wellness. And Consumer Health Complete is my favorite. It provides information for patrons and consumers covering health-related topics from mainstream, contemporary, holistic, and integrated medicine. So I encourage you to check out the evidence-based reports which I've printed many times for patrons as it takes a medication or diagnosis and puts it into accessible language, very similar to the health topics with MedlinePlus. Also, if you work with professionals, your public health department, nursing students, or clinicians, make sure they're aware that they have access to these resources too. So I recently connected with my public health emergency preparedness group, who was amazed at all the resources the library provided that related directly to their work. Okay, so any questions before we moved into programs and services?
Nope, you're just being so informative. Nobody. Yeah.
Sounds great. So the resources I just highlighted can be helpful when updating your subject guides or toolkits. These may also be useful when you're creating services and planning programs. And so next I'll talk through some ideas for services and programs you can host in your own libraries, many of which are provided by NNLM. So please share ideas or things that you have done in the past in the chat with others. So have any of you hosted a National Library of Medicine exhibit, such as the Harry Potter or the yellow wallpaper exhibit at your library? You can learn more about traveling exhibits and how to request to host one by joining the Making Exhibition Connections listserv. The link to that information is in the handout. One of the newer NNLM exhibits is Care and Custody, Past Responses to Mental Health. So this traveling exhibition also has an online exhibit, and it explores the treatment of people with mental health conditions in the past, and it examines history to understand how the country has moved away from custodial forms of treatment to more inclusive approaches that have worked to protect the rights of people with mental health conditions. The online exhibit includes an educational component and a digital gallery of selected works from the historical collection at NLM. Many graphic medicine books address the topic of health, including mental health, creating a unique opportunities for readers to learn about healthcare experiences. The graphic medicine website, graphicmedicine.org, has a blog and a podcast and lots of great books to feature and perhaps to purchase for your collections. Graphic Medicine Ill-Conceived and Well-Drawn is an NLM exhibit about the use of comics and graphic novels as a way to communicate about health, including mental health. The exhibit also has a book list. A few that I've read and recommend are Can We Talk About Something More Pleasant, which is about end-of-life care, and RX, a graphic memoir about being bipolar. In 2020, the World Health Organization produced an informative resource using the graphic novel approach called Doing What Matters in Times of Stress, which helps equip people with practical skills to cope with stressful situations. You could pair this with a program for teens and adults where they learn to create a comic to address some challenging time in their life. Or you might consider hosting a comic artist at your library for the program. This one is downloadable and there are audio exercises and some of them are in multiple languages. Books can also make it easier to talk about topics that we may know little about or that might be uncomfortable. The NNLM Reading Club offers titles and added information regarding health topics to enrich your discussions. NNLM's Reading Club has been going for several years, so they have a large list of topics and related titles with discussion questions, videos, links to health information, read-alike books, and much more. I've hosted 3 reading clubs so far. What I find amazing is how deep the discussion gets and how vulnerable people become as they share information with the group. There's a link on the handout to the club section on the website. May is Mental Health Awareness Month, and you may want to plan a library event to provide information and awareness to your community. Some organizations provide social media images and text and hashtags for you to use as well. Last year, NAMI's campaign included the hashtag more than enough. A few years back, a few colleagues and I coordinated to provide multiple mental health awareness activities, including doing a Make It Okay program presentation, ribbons and safety pins for people to make a supportive ribbon, along with social media posts and videos highlighting library resources related to mental health. There's lots of different opportunities. Stigma can be a barrier to people seeking care for their mental health. Participating in a Stop Stigma campaign can be one way to bring awareness and reduce stigma in your community. By discussing how mental health is part of one's overall health and therefore is interrelated with any other health topic. Your libraries can do this through your social media or through other creative ways to participate, such as offering stickers, wearing t-shirts, or holding a button-making contest. Anoka County, where I work, has adopted the Make It Okay initiative for employees to do just this. And we at the library have offered Make It Okay classes for both staff and the public. I am a trained Make It Okay ambassador. So if you're interested in more information about that, please let me know. If you're still not sure what program to offer, here is one more resource. The Programming Librarian is a place where libraries can share and find programs focused on health or other topics. You can search by the type of library or the topic, and here you can see a few results that appeared when I searched for mental health. There are lots of ideas, and here are even more. These are some other possible resources or programs that you might want to consider at your library. Some libraries have brought in therapy dogs around school final time to help students reduce their stress. Events like this can help give people permission to talk about mental health in an open environment, breaking down that stigma and giving the library a chance to provide additional mental health information. Did we have any programs or questions listed in the chat?
No.
One quiet group. So this brings us to the end of that first part of our outline. And so now I'm going to move in to talking about the consumer health information specialization. So as I mentioned in the beginning, I have level 2 consumer health information specialization. It has been a game changer for me at the reference desk in relation to providing health reference, programming, and partnership in my community. And honestly, it was a game changer when I was at level 1. So first, what is CHIS? CHIS stands for Consumer Health Information Specialization. It's a program that the Medical Library Association provides that offers training in providing health information services to consumers and recognition for that accomplishment of acquiring new health information skills. The CHIS Level 1 consists of 12 hours of training, and you're almost complete with your first hour. The classes are virtual, on-demand, webinars, Moodle sessions, so there's a variety of formats. With CHIS, you gain skills in these areas: understanding your community, health literacy, mental health resources, evaluating health information, and health equity. And Minitex has set the goal for at least one individual in each of the 12 regional public library systems to complete the CHIS specialization. We're hoping that staff from South Dakota, North Dakota, academic special libraries, and others join that challenge. And this fall, we have the 4 classes in the series. And then in 2025, we're going to be hosting a cohort with a group with the goal of collaboratively finishing the CHIS over a 12-month period. The application fee for the specialization is covered by NNLM, which is a great benefit of our free NNLM membership. So this is an overview of getting the specialization: earn, apply, receive, and then keep learning. So the evaluation is the first step to claiming your MLA CE credit. So we do have a QR code available here, and then we'll be adding the link in the chat. So after you complete the evaluation, you receive an enrollment code, and you use that enrollment code to claim credit through the Medical Library Association. I'll come back to this slide. You have 30 days from the date you complete the course to complete an attestation or optional questionnaire and then claim the credit. So you'll go to the MLA Net site, log in, click My Learning, enter the enrollment code from the evaluation, and then the course will be added to your transcript. I put these directions on the handout as well. There are a large variety of CHIS classes. Some are on demand, some are webinars. You can mix and match. One of the quickest paths is to complete the on-demand modules. There's 8 hours available there, covering the essential competencies. And the benefits of organizational NNLM membership include certification of recognition, eligibility for project funding, document delivery services, emergency preparedness planning and response, and partnership with other NNLM members. The outreach efforts of the NNLM assure that researchers, health professionals, and public health workforce and the public are aware of and have access to quality health information available from National Library Medicine and the network of the National Libraries of Medicine. NNLM values and appreciates the contributions of their members, and we extend an invitation to your organization to join in their mission by becoming an organizational member, if you haven't already. So Catherine and I really appreciate you attending today's session. So the link for the class evaluation is in the chat box. And we appreciate your feedback on whether you receive credit or not. So please fill out that evaluation. And then, as I mentioned earlier, please register for Effective Health Communication and Health Literacy, which Catherine will be leading on October 3rd. You can also sign up to receive a weekly email alerting you to recently added NNLM classes and events. Those instructions are on the handouts. And please visit the series site through Minitex. So we have, it's been a quiet group, so we're a little bit early. We have a few minutes for questions or comments. Catherine is, there's a question.
Yes.
So the CHIS program is something that you do individually. So you would receive your CHIS specialization as an individual. The reason that it's a free membership is because your organization is part of it. So I work for Anoka County Library. Anoka County Library is a member. And so I just mark that they're who I'm working with. I'm pretty sure I checked and Minitex is a member. So with this series, you could probably say you're going under Minitex, but we'll have to verify that. But again, joining either as your regional public library system or your individual library, you can join as a member for free. And then the individuals who work at that organization can then create individual accounts and take the classes. And so a little bit more about the cohort program. So I'm in conversations with Maggie Snow from Minitex. We're looking at utilizing a tool. So once a month we would get together and I would teach some of the classes. We would utilize the on-demand classes, and a part of the cohort will be providing opportunities for people to discuss and accountability to move forward and kind of just help everybody track and move towards getting that specialization. So more details to come. Any other questions? I am going to slide back to the slide with the QR code. And then Catherine, if you could put that evaluation link back in the session so people can click on that if they need to. And then we'll just hang out a few minutes. I'm trying to think if I have any other really good stories that I can share. At my public library, we did have somebody who came in and was having a vulnerable adult who had been dropped at the library after being in the hospital. And so they were coming off the stress of being in the hospital and they were completely alone. So part of what we did that day was we helped them find resources so that they could take a bus to get to their family. We helped them find a quiet space so that they could calm down and just kind of listened. And then the main resource we provided for them was how to get safe transportation. We partner with some local organizations, and I recommend looking into seeing what's available. The local organization I work with is called Guild, and they do homeless intake, and they have regular office hours at our library. Catherine, would you be willing to share a little bit about how you use health information in the academic setting?
The mental health ones.
Sure.
Well, in the academic setting, it is more of what I see is one of the things that I do is I'm the liaison librarian to occupational therapy. And a lot of the occupational therapists have to deal with behavioral problems. And so I help them find resources on how they can help their clients who may have a wide range of either cognitive behaviors, neuro development behaviors, the whole wide range of things. So I see it more from the practitioner point of view, where are these resources that they can get for this. But I also then point out to them, especially when I'm I've been maybe tabling or something at a conference or something, where I talk to them and says, okay, when you're dealing with a particular patient, go to share something like MedlinePlus with them, if you need to, or especially for MedlinePlus, if they're working with multicultural communities or multilingual communities, and this is something that's a big thing for a lot of people, is finding out that yes, there are resources out there that are in all sorts of different types of languages that they can then help provide people that maybe English isn't their first language or something like that, to be able to find resources. As part of the NLM, I have been on a state advisory group that we just recently worked with NAMI Minnesota to create a series of crisis handouts that are now on the NAMI website, that we shared a link for it, where it's a list of all the various different types of resources, and we made sure that they were all up to date, and that then we had somebody we contracted with a translation services who then made sure they were in Spanish, Hmong, Ojibwe. Well, now we had 5 different languages, and now I can't remember what they all were, but so that they were available in 5, especially Minnesota-centric languages that we knew people, Somali as well.
Thank you.
You need those types of things. They're downloadable from, you can either download them or link to them from the NAMI website.
Nice. We do have another question. There were a lot of resources listed today. What is the most impactful resource when addressing mental health issues? So a lot of the goal for today was resources about mental health information. For me personally, the things that I found really beneficial for addressing mental health issues have been some of the trainings I've done through NAMI and elsewhere. So there's a QPR training, which is question, persuade, refer, which is related to suicide prevention. There is the Make It Okay ambassador training, where you learn more about just mental health overall and how to kind of utilize conversation to stop stigma. And then another resource is just getting to know my local community and the leaders in my community who are familiar with what issues we face. So we've had training from public health, we've had training from the local police department, and different trainings to kind of help us understand what steps we can take. I am hoping to take the mental health first aid training. It is a 8-hour training, and I'm very excited to see what else I learned there. So I think we're going to go ahead and wrap it up if there's no other questions. Again, I want to thank everyone for joining us today. Especially want to thank Minitex and NLM for making this happen. And if you have any questions or concerns, please reach out to Catherine or I. Otherwise, hopefully we'll see you in a couple weeks at the next session of Effective Health Communication. Take care.